Hi everyone, I'm Amy Flory with Core Balance Therapy, and today I wanted to talk about a movement pattern that we tend to see in people with various conditions. And the person might have low back pain, or pain on the outside of the hip, or pain on the front of the hip, and they can all have this movement pattern in common, and that is that when extending the hip or bringing the leg behind, rather than using the hip joint extensors or glutes or hamstrings, instead of doing that from the hip, they move from the back. And so there's this basically overuse of the back muscles, which may not be symptomatic in some people, and there's some shortening of the tissues on the side of the hip, and weakness at end range of the hip musculature. So someone can be really strong in their glutes here, in this position, like with cycling, but may not be strong here, like with running and getting a really long stride. And to get that, they may be arching their back. So here are a couple of ways that I try to break down that pattern and introduce movement separately at the hip from the back. So the first one I'm going to show is a bridge, and a bridge is a really common exercise. There are lots of ways to do it. It's great for strengthening a lot of muscles, but I'm going to show you how I like to have people do it in a way that kind of eliminates this back extension. So Jay's going to be my subject today. Thank you, Jay. I'm going to have you lie down on your back. So
this way.
And sure.
Okay.
And if our videographer can zoom in here. So Jay, I'm just going to have you go ahead and lift up your hips into a bridge. So what I'm looking for here, and Jay, I'm going to put my hand on your back. So I feel the muscles on the back. And typically what I'm going to feel is the muscles along the spine. Thank you, rest, relax. They're kind of ropey along the spine, and the spine has disappeared into this valley between the ridges of muscle. And so we see that if the trunk is not getting good, like it's not being sandwiched with support from the front and the back body. The back extensors are kind of, off the ranch, so to speak. They're just kind of doing their own thing. So what I want you to do, Jay, is keep your ribs down on the table and lift your hips that way. Okay, so now I'm going to feel your back again. And so now his back muscles have to contract because he is extending his spine, but the muscles are flattened. So what this does is it's going to help to focus the work a little further down, so into the glutes. And so here he's getting really good hip extension, and then I can actually have him reinforce the posterior chain, or the muscles on the back of the leg, by, go ahead and come back up, and pulling the heel back towards the sitting bones. So it doesn't change how the bridge looks, but what happened, did you just get a cramp? But what happens is we get a lot more engagement in the hamstring. And if you get a cramp, don't worry about it. It just means you have to do more of that.
More cramping. I'm on it.
Do it. Okay. So the other thing that I'll have someone do is, Jay, I'm going to have you put your back here against the wall. And, yep, feet out. So this is not an exercise that you do a lot of reps for. It's really to kind of get the idea of getting the rib cage back. Okay, so we kind of quiet the extensors of the back here with this. So the pelvis is going to stay against the wall. And what I want you to do, Jay, is you're going to roll down the wall, like one vertebra at a time. And each time a vertebra comes off, I want you to use your abdominal muscles to push even harder against the wall. And only roll down as far as you can without several segments coming off all at once. And then you go up in reverse. It's like the abdominal muscles are sort of punching each vertebra up the wall. And you're not really going to be able to breathe when you do this one. So maybe 3 or so, but this kind of resets, you know, using the abdominals to help with extension here. Okay, so then we can come back to our bridge, add another layer of challenge. Actually, I'm going to put this strap under your ribs. Go ahead and lie with that under your ribs. Sorry, I need to come up that way. There we go. Okay. All right, so now we're going to do the same bridge. So you're going to keep your ribs down on the strap. Maybe bring your feet out a little bit more so they don't cramp, or so your hamstrings don't cramp. And keep the ribs down. Lift the hips up, and don't let me pull out the strap. Ooh, so strong. Good.
I'm gonna wear a less slickly shirt next time.
All right, go ahead and sit up. You only have to do one of those.
Good.
So just some ideas if you're having difficulty with, you know, back pain, you feel like you're always tight, and you do pelvic tilt exercises and just can't seem to get that to calm down. It might be you need to look a little bit higher, and you might need to work on recruiting those gluteal muscles a little bit more. And we've posted some videos about glute training that you can look at previously. And if you have questions about any of those things, then just mark it in the comments, or if you wanted to talk to a therapist, then just give us a call. Thanks for watching.